Switching gears this morning at 7:35, an important health alert as many of us spend time with loved ones this holiday season. Doctors say the flu, COVID, and RSV infections are all on the rise, but vaccination rates are falling. The CDC says there were 7.4 million fewer flu vaccines administered this year than last flu season. I recently spoke with Andrew Pekosz, an immunology professor at Johns Hopkins University, about this. Here's part of that conversation. What would you say is your biggest concern here with this triple threat? We're talking COVID, RSV, and the flu right now.
Well, we're heading into holiday season and lots of people are going to be visiting. We've just finished up probably a large amount of time where people have gone to holiday parties at work or various other places. And those are the settings where respiratory viruses can really spread the most. So, number one, we expect to see increases in cases because of all of these holiday activities that are going on. And number two, people sometimes think that it's too late to get the vaccine right now, but it really isn't. We expect to see these viruses around for another couple of weeks. So if you get immunized even today, you should provide yourself some protection for the tail end of the respiratory virus season.
I mean, you mentioned it right there. People are going to be spending a lot of time, especially this week, around family, friends. What are some other things they can do to keep themselves safe?
Well, first and foremost, I know no one wants to stay home from a family gathering, but if you're feeling sick, it really is good to stay home and not attend some of those events. It's clear with RSV, flu, and COVID that even before you show significant symptoms, you can spread the virus. So even when you're feeling just a little bit ill, you can still spread the virus. I think if you're in one of the more susceptible groups, such as those over the age of 65 who are more prone to more severe disease from these infections, it's a good time to break out with those masks again, because those will protect you from getting ill, particularly in those settings where there's lots of people around in indoor settings.
And we know those vaccination rates are down significantly. I know you said it's hard to pinpoint, but what do you believe is playing a role in that part? Are people just letting their guard down right now?
Well, I know that we've had a lot of talk about COVID vaccines over the past 2 to 3 years. So I think part of that vaccine fatigue, people call it, is playing into this. So it's really important, though, to message that, again, these vaccines are safe. These vaccines do protect, particularly from severe disease. But they do us no good sitting in the fridges and freezers of pharmacies. They have to be administered. So it really is one of the things that people can do to help themselves keep healthy, but also to help their loved ones keep healthy.
And another important note for RSV, there is a vaccine for adults over 60, but only about 17% have gotten it. And the CDC says there is a shortage of RSV treatments for infants.